Have you ever wondered what those numbers on your blood test results actually mean for your body? It is like getting a secret message from your internal organs, offering clues about your health. Today, we are decoding two important messengers related to your liver. Alanine aminotransferase, or ALT, and aspartate aminotransferase, or AST, are two enzymes commonly measured in routine blood tests. They act like internal alarms. When liver cells are damaged for various reasons, these enzymes leak out into your bloodstream, causing their levels to rise. This elevation is a signal that your liver might need some attention, but it is important to remember that many factors, both liver-related and non-liver-related, can influence these numbers. The main reason ALT and AST levels increase is due to damage to your liver cells. Think of these enzymes as tiny workers inside your liver cells. If the cells are injured, these workers spill out into your bloodstream. Common liver conditions like viral hepatitis, which is an inflammation of the liver, fatty liver disease, and even advanced scarring known as cirrhosis, can all lead to elevated levels. Additionally, certain prescription medications, over-the-counter pain relievers, herbal supplements, and even excessive alcohol consumption can cause liver stress, prompting these enzymes to rise. It is also vital to understand that AST is not exclusive to the liver. It is also found in significant amounts in your muscles and your heart. This means that intense physical activity, muscle injury, or even a heart condition can temporarily increase your AST levels, sometimes more so than ALT. Alanine aminotransferase, or ALT, however, is more specifically concentrated in the liver, making it a slightly more direct indicator of liver damage compared to AST. Your doctor might also look at the ratio of AST to ALT. For example, a much higher AST than ALT, perhaps a ratio of 2:1 or more, can sometimes point towards alcohol-related liver issues. Factors like pregnancy, certain infections, and some genetic conditions can also play a role in influencing these levels. So, what should you do if your test results show elevated ALT or AST? First and foremost, please do not panic. These numbers are just one piece of a much larger puzzle. Your next step should always be to schedule a conversation with your healthcare provider. Be prepared to discuss your recent activities, including any intense exercise, new medications or supplements you are taking, and your alcohol consumption. Your doctor will likely consider your full medical history and may recommend additional tests, such as further blood work, an ultrasound, or other imaging, to get a complete picture of what is happening inside your body. It is helpful to remember that ALT and AST are part of a broader group of tests, often called a liver panel or liver function tests. While they tell us about liver cell integrity, other tests like bilirubin, alkaline phosphatase, and albumin provide information about the liver's actual function and its ability to process waste and produce essential proteins. Understanding these other markers alongside ALT and AST helps paint a truly comprehensive picture of your liver health. The normal range for these enzymes is also just a guideline, and what is considered normal can vary slightly from person to person depending on factors like age, gender, and even ethnicity. Ultimately, elevated ALT and AST levels are signals that something might be out of balance, not a definitive diagnosis of liver disease. By providing your doctor with context and following up on recommended investigations, you empower yourself to understand these internal messages. This proactive approach helps ensure you and your healthcare team can take the best steps to maintain your liver health and overall well-being.